there are anything else other than diet that can also be sorted out, we
Yes,
can talk about it also.
yes. Uh, we can talk about anything. So I
With
think
special reference to that. Yeah.
yes, with special reference to that. So I think we can start now. So here we have today as our guest speaker Dr. Rajesh Taneja. He doesn't need any introduction. We all know him very well. So today I had asked Dr. Saab to talk mostly about diet, but as he said, you can ask anything that you want to ask. And before we begin, we are recording this. So if anybody doesn't want their name or photo to come, then you can just switch off your video because we are going to post it on our social media channels. So if you have any issues, you can just do that. And we also have Gail from Canada and Zita from Hungary. So they will also have
Yeah.
few questions. So Dr. Saab, we will start. My first
Yeah.
question is that most doctors, not most, many doctors, they don't emphasize on diet. And I
Yeah.
think in India, you were the first doctor who actually emphasized on the benefit of diet for IC patients. So, I would like you to talk how important is diet for IC patients.
You see, it's very scientific. You know, when you must have been told that if you have symptoms of UTI, say burning sensation, drink a lot of water. Now, why drink a lot of water? Because water would dilute the urine and the symptoms would reduce. That means the concentration of solutes in the urine is likely to determine your pain. That's the basic thing that I started with. So if you go a little further, when we operate, we are urologists. So when any urologist operates through the urinary passage, he causes small, minimal micro abrasions in the urinary tract, and the patient has burning sensation after urinary surgery, simply like cystoscopy or a very simple procedure through the urinary passage. And that happens because the acid in the urine, when it passes through the urinary passage, it causes burning sensation. Now, what we do as urologists or as surgeons, we add something called alkazol or alkalizing agent. So you have alkazol or alkalizing agent, it causes reduction in the acid of the urine, and that takes away the burning sensation. These are very simple observations, which mean that a simple thing like acidity of the urine, or technically what we call pH of the urine, can determine the symptoms of the urinary tract and can change. So that is the first part. And if you notice, what we have is an Indian diet. Indian diet is full of herbs and lot of spices, and these spices are actually acids. So when these spices or acids, when they are excreted through urine. So you have a chili laden or a spicy food, whether it is simple Indian food or a Thai food or a South Indian food, which is laden with spice, you are expected to have some kind of bladder discomfort or burning sensation. Now, these are small things, very easy to understand. Then there are other things which become little more technical, like if you have tea or coffee or say green tea, you are expected to have an increased urinary volume. And the stimulants in the tea and coffee, the caffeine and the other stimulants in the tea and coffee are expected to stimulate the bladder to contract violently and cause frequency. In addition to the larger volume of urine that is being produced because of the tea and coffee. So these are small things that I'm coming to slowly, from plain water to alkalinizing to tea, coffee to herbs, spices, and then more technical. Now, what is more technical? More technical is, suppose you have an allergy. So some of the IC patients would have allergy. So if you have allergy, say if you have allergy, something comes on your hand or on your skin, you have you have some kind of an eruption. It is like urticaria. In Hindi, we call it chapaki, or it is eruption or urticaria. So that can happen even if you have something to eat. If there is a bee sting, somebody will have urticaria. If you have something to eat to which somebody is allergic, then there will be urticaria. So if there is an urticaria which can involve the skin, you must have seen people with injuries, with inflammation of the mouth, of the tongue because of allergy. We call it angioneurotic edema. That kind of allergic manifestation can occur anywhere in the body on ingestion of certain things. So which means our body can react to certain items when it comes in contact with those items in the form of an allergic manifestation. So what if you happen to ingest something which causes an allergy, and this allergy is manifested in bladder? So there are certain people who will come and tell me if they have, I will tell you, there are some people who would come and tell me that if they take a yellow colored drink, like a Fanta or an orange colored drink, then they would have burning sensation in the urine. They would have urticaria. They would have a lot of reactions. So all these things made me think that there is something which is certainly going to matter, and it is not a rocket science to discover this. There was this doctor patient of mine. She came to me and she said that, look, I had a lot of problems this winter. I was expecting to enjoy because my son and daughter-in-law came from United States, and I had a bad flare. So why did she have a bad flare? Because there, I simply asked her, did they get some dark chocolates with them? And she said yes, and I love those dark chocolates. And you see, this is what happened. She consumed a larger amount of dark chocolates, which triggered a flare. So what I'm coming to is that we have a fantastic body which has a lot of ways of reacting to things. So somebody would like to have spicy food. Other person may not like to have even a little bit of chili in the food. So this variation continues. And so there are certain things to which people are allergic, and other people may not be allergic at all to that food. This shows that there is variation between the individuals when they come in contact with things. And food is something, and food items are some things which we ingest. They go through the mouth, they get into the body, they are absorbed into the body, and they become part of body. So if something like that is there which you are coming in contact with, and if your body happens to react to something like this, then it is only obvious that you will have some kind of manifestation. Now, which part of the body manifests or bears the brunt depends upon an individual person. So there is variation. I'll come back to it again. So we, as school children, we used to know that during the exams or just before the exams, some of the friends would be too stressed and they would have headaches. Others would have vomitings. Others would have diarrhea. So that was exam-induced stress, manifesting as headache, vomiting, diarrhea in three different forms, but they would not affect everybody. They would perhaps affect 2 or 4 people in a class of 30 children. So all these manifestations are variable, unfortunately cannot be quantified. And that is the big reason why in the medical literature, people would not be keen to believe that the food does something to the IC. Now, in medical literature, the scientific way of accepting a thing is to have evidence. So to synthesize that evidence, it is not easy. For example, I tell you that if you have a parachute and you jump from the aircraft with a parachute, you will be saved. Now the science says that give me a proof that I will be saved. That means give me a proof that if I don't jump with a parachute, I will die. No, that is the problem with science. So that is the problem with evidence-based medicine. So unless we have evidence-based, does it mean that if I don't have an evidence, which means that I have 10 people who jump from the aircraft with parachute and 10 people who do not jump from aircraft with the parachute, only then can I give an evidence that yes, parachute helps people to survive despite a jump. So unfortunately, the scientific community understands a randomized controlled trial of one object to another in a vast majority of people. And this being such a fluid thing in me, what it means is that it happens to some people at some times and doesn't happen to others at other times. So it is very difficult to get scientific proof out of it. But yes, as you rightly mentioned, we have our patients. I have a group of patients whom I have been following, and each one of them has taught me one or the other thing that interferes or causes a flare in their IC when they take that kind of diet. I can see one of my patients from Mumbai, and when I visited Mumbai and met him, he told me that his daughter has some problems. And we identified the problem was only that she had started drinking a lot of tea or a green tea. And all we needed to do was to take that tea away, and she improved. So this, this part that I'm talking about is very difficult to prove on the scientific basis. That is unfortunate because evidence-based medicine needs properly constructed, structured scientific trials. But yes, nonetheless, till such time that we have those trials, we will not allow our patients to keep suffering. And that is why I emphasize everyone, those who come to me, that we look very strictly to their diet. So many times I ask them that we need to look at your diet. They will say, no, 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 I have very simple diet. You know, I just get up in the morning and I have 2 liters of water. Then I tell you, okay, so 2 liters of water is not normal diet. You know, if you take a donkey, donkey is an animal which is, you know how we treat a donkey mentally. So if you take a donkey to a pool of water, if he is not thirsty, he will not drink. But a man gets up in the morning and drinks 2 liters of water, whether he is thirsty or not, simply because somebody has told him, you drink too much of water, you'll be fine. I mean, that is what we need to understand. We need to understand each bit that you have. And that takes time, unfortunately. Not many clinicians are willing to spend that much time with their patients. So you tell them, okay, what do you have next? No, I have a cup of tea. So what do you put in the cup of tea? So I put ginger, I put cloves, I put cinnamon. And this happens beginning of the COVID. So there was this lady who brought his son who was 10 years, and she said he has started troubling me because every 10 minutes he wants to go to washroom. I said, what do you do to him? What have you started doing in the last 1 month? So this lady has been giving this poor child a concoction of ginger, turmeric every 2 hours to save him from coronavirus. The poor guy has burning in the urine and is passing urine every 15 to 20 minutes. And the mother is too strict with the child and she is insisting that you are misbehaving. The poor guy didn't know what to do. Finally, they landed up with me and I discovered that for last 1 month, this is what this lady was doing to the child. So And all in good faith. She said, I'm only trying to protect my child. So diet has an immense role to play in this disease process. And I would be very happy to answer any of the questions that you have. But it is important for me to lay down the foundation of this talk by this kind of a example that I have given.
Sir, I would also like you to tell us that how to find our triggers, because it
Yes.
seems that all of us have different triggers.
See, first thing is that we should write down everything on a diary. For example, we may say that I'm having the same lentil or dal and sabji as other people in the family are having, but that means it is safe. It is not like that. So what I tell my patients that in the next visit when you come, you write everything that you have taken. I will analyze what you have taken. And then we will analyze what is hurting you. So you put your diet on one side. Even if you have taken a glass of plain water, please enter that. And on the other side, write the time when you have had flare. So by that, by analysis of say 7 days or 10 days of such chart, one should be able to identify the offending agents. That is when the patient is putting in as much effort as I'm trying to put in and is being honest in recording, because recording may not be easy. It is easier said than done. You are cooking something and then you are cooking a meal for your family, and then you come out and in the evening you have forgotten, oh, Dr. Taneja asked me to write, so let me write something. So they will write something and which may not be the true reflection. So it is very important for us to have the right data. So I call it a food diary. In the food diary, you also put a red mark that you had a flare at this time. And when we analyze this food diary, we may be able to find, okay, these are the four products or 5 products which have caused this in your case. So one of the commonest thing is mangoes. Now in India, we have a variety of mangoes. So there are certain people who will say, I have a problem with mangoes. The other people will say they don't have a problem with mangoes. I'm talking about the IC patients. But what happens is that some patients are exposed to a particular variety of mangoes, and that is when they have a flare. And if the others are exposed to the same variety, maybe they may or may not have a flare. And some patients will say, I can accept this variety of mangoes, but I cannot accept the other variety of mangoes. So I don't have flare with one variety of mangoes, whereas I have a flare with this variety of mangoes. So things can be so specific, and we need to find out. It takes effort. So the best way, Balaka, is to educate our patients. Let them be empowered to think and open their minds and look at their own diets, because that is the single most important thing that is going to help these patients identify what is troubling them. We are already there. We are always there. We are always there to help them identify, but they need to collect data and bring to me. The other thing is that if there is a significant flare up and there is a lot of pain, I say you leave everything, go on a bland diet for 10 days. So you go on a bland diet and you become better. Then slowly you introduce one thing at a time, one thing once a day from one time to another time. And then you can, that is how you can actually identify which thing is, which item in the food is troubling you more, and then you can modify your diet accordingly.
Gautam Tyagi has a question regarding cystoscopy.
Yes. Hello.
Hello. Hello.
Yes, yes.
Sir, good evening.
Good evening.
Yes, sir. My question is cystoscopy necessary to identify the IC?
See, cystoscopy is necessary to exclude other things which may present as IC. Like if you have problem, I may know you are a patient or you are a doctor or
Yes,
what?
yes, I'm a patient here.
You are a patient. So
Yes,
I will not use technical language. So
yes.
cystoscopy, when we do cystoscopy, we confirm the diagnosis that yes, this is the IC. Then cystoscopy can exclude that, okay, see, I have recently seen only 2 weeks ago a patient who was being treated as IC by somebody else for 2 years. He came to me and I said, there's something wrong. I want to do a cystoscopy. I did a cystoscopy and I found a cancer.
Oh,
And maybe next week I'm going to remove this bladder. So it is very important to do cystoscopy because there may be things which may just appear like, just urinary symptoms, but they happen to be something else. The other thing is, even if it is interstitial cystitis, we need to document, okay, if there is Hunner's lesion or not. If there is a Hunner's lesion, it means that your disease process is kind of different. So our strategy of management changes. So if you have a Hunner's lesion and if I burn it at the time of cystoscopy, there is almost instant relief in the coming times. The pain may come back, but that is because the interstitial cystitis comes back. But at that time, if you burn the Hunner's lesion, that helps. So if you don't do cystoscopy, you will not know that this patient has Hunner's lesion, and the patient will keep suffering, and you will deny a treatment, which is burning of a Hunner's ulcer. The other is that patients with interstitial cystitis have small capacity bladder because their bladders have not held on urine for a longer time. They will just pass urine as soon as it is full, say 50 ml or 100 ml. Normal bladder capacity is 500 ml. So such patients will be benefited when you do cystoscopy under general anesthesia. You distend the bladder, you balloon out the bladder. So the bladder capacity increases, and that is how it helps. So if you don't do cystoscopy, how else are you going to treat this patient? So that is why it is imperative that we do cystoscopy in patients of interstitial cystitis.
Dr. Manisha, she has a question.
Yeah, okay. Doctor, namaste, sir. Now
Namaste.
it's advisable to take vitamin C and zinc to boost the immune system. But we as a IC person cannot take citrus fruits. So is it advisable to take vitamin C and Bicosul with zinc supplement?
I know it is a terrible situation. You are not the only one who's suffering and has asked this question. You see, I will suggest that if
Hello?
Hello. Hello.
I think something wrong with Dr. Taneja's connection.
Yeah.
Hello? If anyone else has a question, just please keep it ready. We will keep asking.
hello, sorry,
Yes.
there was a disconnection.
Yes.
Yes, can you hear me now?
Yes, sir.
Yes, sir. Yeah.
Yeah. So if you see, vitamin C is an acid, and if you take citrus soda, it neutralizes the acid in the urine, not in the body, in the urine. So you have taken vitamin C, like either a lemon in a glass of water or a tablet of vitamin C. And then if you have taken, if you have symptoms, you immediately take citrus soda, because citrus soda is going to neutralize in the urine, in the bladder, not otherwise. So vitamin C will, hello,
Yes, sir. Yeah.
can you hear me?
Yes,
So
sir.
vitamins, yeah. So vitamin C, whatever you ingest goes into the blood and it does its job, and then rest of it is excreted through the urine. And it is then when it becomes troublesome to you. So you neutralize it in the bladder and your symptoms will be taken care of.
Yeah. Okay, sir. Thank you.
what about vitamin B12? Because I personally get a flare after with B12.
Yeah. You see, the problem with B12 is that you can have a variety of B12 preparations. So when you have it in one syrup form, or whether you have it in a capsule form, or whether you have it in an injection form. So it is the carrier with vitamin B12 which becomes important. So vitamin B12 is a very small molecule. So unfortunately, the carrier, which is the syrup in which it is dissolved and is given to you or is dispensed in a syrup, you are actually having problem with the carrier. For example, you would try this next time. If you take injection of vitamin B12, will it still hurt you or cause a flare? Have you noticed this? Your speaker is off.
No,
Have
no,
you
no.
noticed that it repeats? Yeah. So it is the liquid in which vitamin B12 is being dispensed that hurts the bladder.
Okay. Okay. Dr. Brahmanand Pandeji, you have a question? Hello? Hello?
Yeah, yeah. 1 minute.
Hello. Am I
Hello, sir.
audible?
In the meanwhile,
Yes.
I want to ask one thing.
Yes.
Can IC patients have green beans or Karela in their diet? Green beans or French beans?
See, French bean appear to be benign. They are morely alkaline. Even Karela is supposed to be an alkaloid. The problem with Karela is the way we cook it. When we cook Karela, we have to put a lot of spices to override its bitterness. And it is
Okay.
that which troubles. See, bitterness in the vegetables is because of alkaloids. Alkaloids does not mean alkali, but it is
Mhm.
alkaloids. Any strong irritant can hurt the bladder. Alkaloids, because they get neutralized in the acid, they may not hurt as bad. But
Okay.
with bitter gourd, which is Karela, if
Mm.
you have, because it has to be processed in spices, you cannot have Karela otherwise. It is the spices which hurt you.
Okay. Okay. Thank you, doctor.
Yeah, hello. Can I ask a
Yes,
question?
yes, yes,
Brahmanand Pandey here.
yes, yes, yes.
Sir, good evening. I had
Good
spoken to
evening.
you after
Yes,
lockdown ends.
yes.
I'm a very old and chronic patient of IC. So, basically, regarding diet, I wanted to know one thing that suppose I have experimented it long time. Suppose I'm on a bland diet. uh, 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 Even then my situation remains same. So whether I take spicy food or any type of food, it doesn't escalate that much. So can I interpret that I'm not sensitive to the food or its ingredient, and reason is something else for the irritation and pain, sir?
Mr. Pandey, if you remember last time when I talked to you and you had a question, and I told you that it is very difficult for me to answer your question because you have compounding factors like stricture, urethra, stone, and other things. Now, interstitial cystitis, somebody has labeled you, but interstitial cystitis can be of two varieties. One, which is primarily inside the bladder. The disease is inside the bladder. It is those patients who will have a problem with they will have a problem with the food. Your problem appears to be something which is other than bladder and somehow is getting manifested as bladder. If you remember, somebody diagnosed you as
Yes,
chronic prostatitis. So if you have a chronic prostatitis,
yes,
that is not going
yes.
to. So it is the proof that you have just mentioned. It is the proof that if the diet doesn't hurt you, perhaps the disease is not in the bladder. It is somewhere else,
Mhm.
or at least it
Okay.
does not appear to be the classic interstitial cystitis. it is something different.
Yes. Sure. Yeah, definitely. Thank you.
Yes,
Yeah, I'm
anything
okay.
else?
Anybody else? No, I'm okay, sir. Thank you very much.
You're welcome. Because your problem appears to be beyond bladder. Beyond bladder.
Yeah.
It's not bladder. That's why the diet is perhaps not helping you.
Mm-hmm. Sure, sir. Thank you.
Yes.
Yes,
Is there
doctor.
any
Good
other
evening.
question?
Yes, doctor. Good evening. Mahesh Bagaria here from Bombay.
हाँ जी नमस्कार, कैसे हैं बगेरिया साहब?
बहुत है सर, बलाका को भी धन्यवाद कि उन्होंने आपको लॉकडाउन पीरियड में हम लोगों से मिलवा दिया।
नहीं वो तो था ही था, करना ही था, तो नहीं करने का कोई मतलब ही नहीं है।
For the other viewer, I just give a background, small background. मेरा interstitial cystitis इन्होंने डॉक्टर साहब ने बहुत अच्छे तरीके से मालूम करके तुरंत सॉल्व कर दिया उसको। Now I am almost everything is okay without medication almost. So डॉक्टर साहब ने जैसे बताया था, अभी मेरे डॉटर के लिए बोल रहे थे बॉम्बे में, उनका भी कुछ ऐसा फ्रीक्वेंसी का प्रॉब्लम आया, दिखाया इनको। तो जैसे उन्होंने, मैंने सोचा कि भाई ये क्रॉनिक है तो मेरा कहीं इनहेरिट वाला तो नहीं हो गया उनको भी। तो इन्होंने खाली जस्ट बताया कि चाय की प्रॉब्लम है, उन्होंने चाय बंद कर दी और डॉक्टर साहब शी इज क्वाइट ऑल राइट नाउ। तो ऐसा होता है, और कोई डॉक्टर्स होते तो बोलते चलो ये कर लेते हैं वो कर लेते हैं, लेकिन आपने तो बातों बातों में ही बता दिया इलाज उसका।
नहीं, वो जो होने की बात है।
तो मेजर तो ऐसे एक चीज था मेजर इसमें, अभी जैसे लॉकडाउन में मेरी वाइफ को इचिंग प्रॉब्लम हुआ था, तो मैंने उनको बोला कि सॉल्ट बंद कर दो डाइट में। एंड द सेम डाइट आई स्टार्टेड यूजिंग दैट विदाउट सॉल्ट। तो मैंने क्या देखा, अभी 4-5 दिन से जब विदाउट सॉल्ट का मैं यूज कर रहा था, वेजिटेबल इन ऑल एवरीथिंग, तो मेरी फ्रीक्वेंसी में काफी इंप्रूवमेंट जैसा लगने लग गया ऑल ऑफ सडन। जैसे 1 आवर का 1.5 आवर का फ्रीक्वेंसी था, तो वो 2 आवर्स 1.5 आवर्स ऐसा कुछ थोड़ा इंप्रूवमेंट लगने लग गया। तो मैं कहा जस्ट आपको बताऊं कि नमक से भी कुछ फर्क पड़ता है क्या?
देखो, आपने सिखाया मुझे। मैं तो हमेशा यही कहता हूँ कि आई लर्न फ्रॉम योर एक्सपीरियंसेस, है ना, इट इज वेरी इंपॉर्टेंट। और मैंने जैसा कहा, आई एम्पावर द पेशेंट टू थिंक about the diet. See, that has worked. So as far as this is such a unique disease, why are we having this conglomeration of patients? Is because we learn from each other. Nothing very concrete means जो किताबों में लिखा हुआ है, जो scientific community में है, that is always there. But more important than that, we need to learn from each other. And this is one of the biggest examples that you've just told me. I never thought that salt can do that. But now
अच्छा
that
एक्सपीरियंस रहा ये हमारा।
So this is good. This is good. It is learning for me.
Ruby Sahani ji.
Thank you.
Yes. Yes. Hello. Can you hear me?
Yes. Yes, we can hear you.
Namaskar ji. Yes.
Namaskar, doctor. I just wanted to ask you. I've been taking Atarax for about Cystopen for about 5 years with Atarax. And I thought maybe I'll gradually reduce it. So I started taking it twice a day instead of thrice a day. But after a few days, I started getting pain. And so again, I went back to thrice a day. The pain continued for some time. It's much less now. So I just wanted to ask, does Cystopen have any dangerous side effects if taken for a very long time?
Yes. So you being an ophthalmologist, Dr. Sani, you would know that there is something called pigmentary maculopathy. There is an atypical pigmentary maculopathy which has been reported with pentosan polysulfate, that is Cystopen or Camphora, when taken more than 10 to 13 years. So we are still working on it, and there is an attempt to identify the maximum allowable dose in the lifetime. So it may be maybe 1500 grams or something, but we are still on it. This is the latest. This is April 2020 article I'm quoting. April 2020 article. So it's Canadian Ophthalmology Society article, which has just come in the April month. So they are trying to find out a threshold of dose of cystopen. So normally it is 100 milligram 3 times a day. So they
Yes,
are
that's
looking at 1500 grams or something. But we don't know it is whether it is duration or whether it is the amount of pentosan polysulfate. So I will suggest that you should, and it is very important for people like you who have been with me for more than 10 years now, that
yes, since
we,
2009.
yeah, so that we decide what to do with this. And Atarax is because, as I mentioned, certain food items will have allergic reaction to the bladder. So your bladder appears to be that kind which has allergy, and
Yeah,
uh,
taking
and that is
Atarax.
why Atarax happens to work. So if that is so, I'm not very happy to continue Cystopen and Comfora because it's already 10 years. And you also look up the literature and we can discuss
Five,
one
five,
to one.
5 years actually, because I took it for some time, then I had stopped it. Then for a few years, and then I started again second time after you did the hydrodistension and the burnt the Hannah's lesion.
Okay.
Then after that again I started it. So now it's about 5 years from that time also.
Hmm.
So okay, then when the lockdown is over, I'll come and talk to
No,
you about it.
no, you can also look up the literature yourself. Being an ophthalmologist, I've given you a lead. You
Oh,
just, you just, you just search for pigmentary maculopathy by pentosan polysulfate. You just Google
oh,
it and you'll know.
okay, I'll do that. Thank you.
Yes, we would also be grateful, Dr. Sahani, if you do this for us.
Sure, I'll do that.
Because, yes, um, somebody else had a question. Okay, Atul also had same question. He also wanted to know about how long can he take pentosan. I hope Atul, your answer is replied now. Atul, yeah,
Yeah, yeah, yeah, yeah.
yeah.
Yeah, I'm
Uh,
Jagrati.
okay, yes, okay.
Okay.
Yeah,
Okay.
Atul is my
So,
husband. So
Yes.
I think I've become dependent on pentosan polysulfate. So I've been taking it off and off for 2 years, often on and off for 2 years now. Is it okay?
yes, you
Doctor, is it
see,
okay?
yeah, yeah. You see what pentosan polysulfate or cystopen does. It forms a layer in the bladder.
Yeah.
And if you have that layer and it stays for say 6 months after you have stopped, you are
Okay.
actually giving your bladder, your body, a 6 month drug-free period, which is a very good thing to happen.
So
So
now I've been taking it for the past 1 year. So since
yeah,
the lockdown, my medicine is exhausted. Now very little medicine is left, so I'm taking just OD dose. I think I'm psychologically dependent. I'm taking just OD dose, and I feel it's fine till the lockdown is over. I can get the medicine after that. Is it okay?
no, you can get the medicine. You can take, yeah, you can, but don't take it once a day because you stop it altogether. I think that will be
Okay.
better
Okay.
because
Okay.
once a day dose is going down the drain actually.
Okay. Okay. That's what I wanted to confirm.
Yeah,
Okay. Thank
you
you,
can
doctor.
stop it altogether
Okay.
and you can get a
Okay.
prescription.
Okay.
Some of the patients, they are fasting now. So they have a question that what is the relationship between fasting and ice? So
Yeah. So, you know, the problem with fasting is the concentration of urine. As I said, if you are having symptoms, somebody tells you to drink a lot of water because if you have a lot of water, the urine becomes dilute. If you just reverse this issue, that means if you stop taking water and you're dehydrated, urine becomes concentrated and it should technically cause more symptoms. Uh, that is one part. The second part is that the religious fasting that they have it, after they start eating, the food is very rich. It has a lot of spices also. So when you have a rich spicy food after a fasting thing, then you may have a burning sensation because you've already fasted. The urine is now concentrated because, you know, when you start fasting, say for 10 hours, the beginning of the fast, you have already taken a lot of water. So you have a water reserve. So next 6-8 hours, you are neither taking anything which will cause highly concentrated, which will cause spices in the urine, but you have already got enough water in your body to produce reasonably dilute urine. But towards the end of the fast, especially towards the end of the fast, you are dehydrated, your urine starts getting concentrated, and that is the time when you consume spicy meal, and that is when you start having a burning sensation. So it is all about your understanding. What do you want in life? If you are having a burning sensation when you break your fast and have something spicy, you know that yes, you have done something because of which you have a burning sensation. So do not get upset with it. You have chosen to have it like this. It is okay. It is absolutely fine. Do not get worried on that.
Juniara Afrin, she has a question.
Yes.
हेलो
Hello, Juniara.
हाँ सर गुड इवनिंग
Good evening.
सर मैंने 2 दिन पहले जब मैं रोजे के लिए ये शहरी लिया था, फिर सुबह मॉर्निंग में भी मेरा यूरिन अटक गया था, फिर आज भी हुआ था मॉर्निंग में भी। हाँ, तो कभी कोमोट में कभी इंडियन में बैठ के मेरा यूरिन जो ब्लैडर है और यूरिन की ट्रैक थोड़ा सा दर्द और बिल्कुल यूरिन पास नहीं होना चाह रहे। और बार्निंग जो है वो पूरा रोजे में जब मैं फास्टिंग रह रही हूँ तब मेरा बार्निंग ठीक है, लेकिन जब इफ्तार करने के बाद मेरा बार्निंग हल्का सा शुरू हो रहा है, लेकिन मैं ज्यादा स्पाइसी पकोड़ा बिल्कुल नहीं लेती हूँ, मतलब 1-2। तो आप क्या करें सर इस सिचुएशन में?
जुनियारा देखो, तुम्हारा आई नो तुम्हारा क्या प्रॉब्लम है। तुम्हारा प्रॉब्लम है पेल्विक फ्लोर स्पैज्म। तुम्हारा प्रॉब्लम है पेल्विक फ्लोर में स्पैज्म हो जाता है, आईसी है, साथ में पेल्विक फ्लोर स्पैज्म है, और ये पहले से है। शुरुआत में ही, अगर तुमको याद हो, जब हम पहली बार मिले थे,
2015
आपका ऑपरेशन हुआ था, है ना? आपका ऑपरेशन हुआ था, वो डॉक्टर ने किया था, उसके बाद से रुकावट हो गया था पेशाब का, याद? तो मैंने जो अभी कहा कि आप जब फास्टिंग करते हैं तो आपका यूरिन उस वक्त, आप कुछ खा नहीं रहे हैं और ये पानी सफिशिएंट है, तो आपने क्योंकि कुछ खाया नहीं तो कोई टॉक्सिन आया ही नहीं जो कि आपके ब्लैडर को हर्ट करता है। लेकिन टुवर्ड्स द एंड ऑफ द फास्टिंग आप डिहाइड्रेट हो जाते हैं। तो मैं चाहूंगा कि जैसे ही आपका फास्टिंग खत्म हो, सबसे पहले आप 2 गिलास पानी पी लीजिए, उसके बाद कुछ भी खाएंगे तो बर्निंग नहीं होगा, वो इम्पोर्टेंट है। और दूसरा इशू ये है, क्योंकि आपको पेशाब रुकने वाला है, तो उसके लिए फिजियोथेरेपी सबसे इम्पोर्टेंट चीज़ होती है। फिजियोथेरेपी के अलावा जो हम क्लोनाजिपाम देते हैं, क्लोनोट्रिल देते हैं, क्लोनोट्रिल जो है वो स्केलेटल मसल रिलैक्सेंट होता है, क्लोनोट्रिल देने से आपको यूरिन आना चाहिए।
सर क्लोट्रिन भी ले रही हूँ, डेल्टम भी ले रही हूँ।
हाँ, हो सके तो पेल्विक फ्लोर एक्सरसाइजेस करना चाहिए। और सबसे बड़ी बात यह है कि पेल्विक फ्लोर स्पैज्म में बायोफीडबैक का बहुत रोल है। मतलब कि हो सकता है आप एक्सरसाइज कर रहे हैं, लेकिन आपको ऐसा लग रहा है कि आप ठीक से कर रहे हैं, लेकिन वो कहीं पे छोटा भी उल्टा हो रहा है, तो जो मसल टाइट होनी चाहिए, जो रिलैक्स होनी चाहिए, वो टाइट हो रही है, तो सारा उसका असर जो है वो उल्टा हो जाता है। तो मैं चाहूँगा लॉकडाउन ख़त्म होगा तो आप डिपार्टमेंट ऑफ फिजियोथेरेपी में आए हमारे अस्पताल में, और जो भी आपको देखेंगे वहाँ पे मैं उनसे खुद बात करके बताऊंगा, और आप बायो फीडबैक की बात करें ताकि आप समझें कि आप घर में ठीक से कर रहे हैं कि नहीं कर रहे। यही इसका इलाज है।
Sir, yesterday we were discussing about swimming to release pelvic floor spasm. So
That's
can you
right.
also tell this to every person?
Yeah, I always tell my patients who have pelvic floor spasm that if they can do swimming, nothing like it. If they can swim, And many of my patients, they report back and they tell me that soon after the swim, the urine is absolutely fine, as if there is no problem. So swimming, the best is to have a freestyle swimming, or even on the backstroke. If you can do something like backstroke, that relaxes your pelvis very well. But important problem is that in place like India, it is very difficult to have good swimming pools, where safe swimming pools which are adhering to the norms and the recommendations, standard recommendations of cleaning, contamination, and overusage. All those things need to be sorted out. So it is not very easy in a country like ours, where I can only tell you that swimming works, but I cannot give you an option that you can go to such and such place, and that will be, maybe some days, after some years, the hospitals will evolve and they will have their own swimming pools in their compound only for such patients. I hope to have. Why don't you take up that task
No,
internationally?
I go to a good swimming pool, but the problem is they are very good and they clean their pool twice a day with chlorine. And that chlorine is something that irritates me. That flares me up.
Yeah, so yes, chlorine can irritate in two manners. One, once it goes into the body through the fumes, through the nose and respiratory tract, then it gets diffused into the blood, and it is highly acidic. And that is what is excreted in the urine. So if you can take citrus soda before that, it's fine. If you have allergy to this chlorine, which some people have allergy to chlorine, then Atarax is a better thing. You may decide, but don't take Atarax before the swim. Come out of the swimming pool and take an Atarax, because Atarax can cause drowsiness. I don't want you to be drowsy inside a pool.
Okay, Mrignani has a question. Mrignani?
Yes, ma'am.
Yes, Mrignani.
हाँ हेलो नमस्ते सर.
नमस्ते जी.
सर वो लास्ट ईयर सितंबर में डिलीवरी हुई थी. तब तक तो सब नॉर्मल था, कोई मेडिसिन नहीं खा रही थी मैं. फिर उसके 2-3 महीने बाद ही जब डेट्स आना स्टार्ट हुआ, फिर से प्रॉब्लम होने लग गया मेरे को. तो अभी मैंने वही स्ट्रिक्ट डाइट पे हूँ अभी, और सारा कुछ बंद किया हुआ है, लेकिन अभी मेडिसिन नहीं ले रही. मैं आपके पास आने का सोच ही रही थी, फिर इधर ये लॉकडाउन हो गया.
तो मृगनैनी, क्या होता है, ये पूरी किताबों में लिखा हुआ है कि प्रेगनेंसी में ईस्ट्रोजन होता है. तो प्रेगनेंसी में ईस्ट्रोजन होने से इतना ज्यादा ईस्ट्रोजन होता है, जो प्लेसेंटा होता है बच्चे के साथ, उससे इतना ज्यादा हार्मोन निकलता है, तो वो इंटरस्टिशियल सिस्टाइटिस को सप्रेस करके रखता है. और ये केवल आप नहीं है, बहुत सारे लोग हैं जिनको ये एक्सपीरियंस होता है. तो ड्यूरिंग द प्रेगनेंसी, 1-1.5 साल प्रेगनेंसी के बाद भी 6-8 महीने वो ठीक रहते हैं, उसके बाद ये दोबारा आ सकता है. तो अगर आप चाहें तो आप कॉम्फोरा या सिस्टोपेन जो भी लेती थी, आप सिस्टोपेन या कॉम्फोर शुरू कर लें. तो और डाइट का तो आप ध्यान रख ही रहे हैं, तो ये बढ़ेगी नहीं.
हाँ, डाइट मेंटेन कर रही हूँ, तो
का इंतजार न करें.
अच्छा,
आप सिट्रस सोडा कम से कम दिन में 2-3 बार ले लो. नहीं तो खाने का सोडा घर में पड़ा है तो वो 2-3 बार ले लो. तो खाने का सोडा एक चुटकी मुंह में रख के ले सकते हैं, या उसको